Headache basics. Headaches can be more complicated than most people realize. Different kinds can have their own set of symptoms, happen for unique reasons, and need different treatments. Once you know the type of headache you have, you and your doctor can find the treatment that's most likely to help and even try to prevent them. Common types of headaches. There are over 150 types of headaches, but the most common types include tension headaches. Tension headaches are the most common type of headache among adults and teens. They cause mild to moderate pain and come and go over time. They usually have no other symptoms. Migraine headaches. Migraine headaches are often described as pounding, throbbing pain. They can last from 4 hours to 3 days and usually happen 1 to 4 times a month. Along with the pain, people have other symptoms, such as sensitivity to light, noise, or smells, nausea or vomiting, loss of appetite, an upset stomach or belly pain. When a child has a migraine, they may look pale, feel dizzy, and have blurry vision, fever, and an upset stomach. A small number of children's migraines include digestive symptoms, like vomiting, that happen about once a month. Cluster headaches. These headaches are the most severe. You could have intense burning or piercing pain behind or around one eye. It can be throbbing or constant. The pain can be so bad that most people with cluster headaches can't sit still and will often pace during an attack. On the side of the pain, the eyelid droops, the eye reddens, the pupil gets smaller, or the eye tears. The nostril on that side runs or stuffs up. They're called cluster headaches because they tend to happen in groups. You might get them 1 to 3 times per day during a cluster period, which may last 2 weeks to 3 months. Each headache attack lasts 15 minutes to 3 hours. They can wake you up from sleep. The headaches may disappear completely. Your doctor will call this remission, for months or years, only to come back later. Men are 3 to 4 times more likely to get them than women. Causes of pain in the back of the head. Chronic daily headaches. You have this type of headache 15 days or more a month for longer than 3 months. Some are short, others last more than 4 hours. It's usually one of the 4 types of primary headache: chronic migraine, chronic tension headache, new daily persistent headache, Hemicrania Continua. Sinus headaches. With sinus headaches, you feel a deep and constant pain in your cheekbones, forehead, or on the bridge of your nose. They happen when cavities in your head, called sinuses, get inflamed. The pain usually comes along with other sinus symptoms, like a runny nose, fullness in the ears, fever, and a swollen face. A true sinus headache results from a sinus infection, so the gunk that comes out of your nose will be yellow or green, unlike the clear discharge in cluster or migraine headaches. Posttraumatic headaches. Post-traumatic stress headaches usually start 2 to 3 days after a head injury. You'll feel a dull ache that gets worse from time to time, vertigo, lightheadedness, trouble concentrating, memory problems, tiring quickly. Irritability. Headaches may last for a few months. But if it doesn't get better within a couple of weeks, call your doctor. Less common headaches. Exercise headaches. When you're active, the muscles in your head, neck, and scalp need more blood. Your blood vessels swell to supply them. The result is a pulsing pain on both sides of your head that can last anywhere from 5 minutes to 48 hours. It usually hits while you're active or just afterward, whether the activity is exercise or sex. Hemicrania Continua. Hemicrania Continua is a chronic, ongoing headache. Almost always affects the same side of your face and head. Other symptoms include pain that varies in severity, red or teary eyes, runny or stuffy nose, droopy eyelid, contracted iris. Responds to the pain medication indomethacin. Worse pain with physical activity, worse pain with drinking alcohol. Some people also notice migraine symptoms like nausea and vomiting. Sensitivity to light and sound. There are 2 types. Chronic. You have daily headaches. Remitting. You have headaches for 6 months. They go away for a period of weeks or months and come back. Hormone headaches. You can get headaches from shifting hormone levels during your periods, pregnancy, and menopause. The hormone changes from birth control pills and hormone replacement therapy can also trigger headaches. When they happen 2 days before your period or in the first 3 days after it starts, they're called menstrual migraines. New daily persistent headaches, NDPH. These may start suddenly and can go on for 3 months or longer. Many people clearly remember the day their pain began. Doctors aren't sure why this type of headache starts. Some people find that it strikes after an infection, flu-like illness, surgery, or stressful event. The pain tends to be moderate, but for some people, it's severe. And it's often hard to treat. Symptoms can vary widely. Some are like tension headaches. Others share symptoms of migraine, such as nausea or sensitivity to light. Call your doctor if your headache won't go away or if it's severe. Rebound headaches. You might also hear these called medication overuse headaches. If you use a prescription or over-the-counter pain reliever more than 2 or 3 times a week, or more than 10 days a month, you're setting yourself up for more pain. When the meds wear off, the pain comes back and you have to take more to stop it. This can cause a dull, constant headache that's often worse in the morning. Rare headaches. Ice pick headaches. These short, stabbing, intense headaches usually only last a few seconds. They might happen a few times a day at most. If you have one, see the doctor. Ice pick headaches can be a condition on their own, or they can be a symptom of something else. Spinal headaches. Talk to your doctor if you get a headache after you have a spinal tap, a spinal block, or an epidural. Your doctor might call it a puncture headache because these procedures involve piercing the membrane that surrounds your spinal cord. If spinal fluid leaks through the puncture site, it can cause a headache.